Hey guys, good morning, it's Nathan here. I'm gonna do a quick video on Pregabalin, is better known as lyrica. This is a widely used drug, not only in the United States, but all over the world. And particularly Pregabalin is marketed under the brand name Lyrica, among others. It is a medication used to treat epilepsy, neuropathic pain, fibromyalgia, restless leg syndrome, and GAD, generalized anxiety disorder. Its use in epilepsy is an add-on therapy for partial seizures. So that's like not only just as a single treatment, there's other treatments that people use for seizures. That's just another good treatment for seizures and acute seizures. But as far as that goes, when used before surgery, it reduces pain, but results in a greater sedation and visual disturbances. It is taken by mouth. Common side effects include headache, dizziness, sleepiness, confusion, trouble with memory, poor coordination, dry mouth, problem with vision, weight gain. Serious side effects may include agoraemia, drug misuse, increased suicide risk when pregabalin is taken at high doses over a long period of time. Addiction may occur, but if taken at usual doses, the risk is low. Use during pregnancy or breastfeeding is of unclear safety. Pregabalin is gabapentinoid and acts by inhibiting certain calcium channels. So I'd say some of these side effects listed are pretty spot on, but I usually get like a upbeat amount of energy from actually taking this. I mean, it affects different people differently, other people differently, but usually whenever I take Lyrica, it's kind of does take anxiety away, and it gives me an upbeat sense of like my day is going better and I got more energy and I could do more things on point. Like this coordination stuff, it's like the totally opposite for me. I feel like I could do more. I feel like I could accomplish more as far as like task and my day. I get more done in a day. But anyways, pregabalin was approved for medical use in the United States in 2004. It was developed as a successor to gabapentin, which gabapentin, I could say, is effective, just as effective as Lyrica or pregabalin, as far as the same sense of effects and symptoms that I just told you guys. There is not only listed that I listed, but there's other different types of things that aren't listed because there's more study to be done. And there's another video I need to make on gabapentin, but it is available as a generic medication in a number of countries, including the United States as of 2019. In the US, the wholesale cost is about $11 per month as of October 2019. While in the United Kingdom, a similar dose costs the NHS about £6 as of 2018. In 2016, it was the 83rd most prescribed medication in the United States, with more than 9 million prescriptions in the US. Pregabalin is a Schedule 5 controlled substance under the Controlled Substance Act of 1970s. So yes, this drug does get you high, like I've said. They obviously know people misuse it. That's why it is a scheduled drug. Now, the other issues that come along with long-term use is the simple fact, if you go without and start withdrawing from this medication, there's extreme symptoms as far as like long-term use and just stopping cold turkey. I've noted that some people have like these waves of terror, like not just like anxiety or anything like that, or just like discomfort, like terror, like there's a genuine terror that comes over people, and they don't generally know why. And I've seen this happen with people, specific people that have been prescribed it, but then just like I said, every person is different. Me, I could go long-term use and not have extreme effects like that, but it does affect you to some extent. I don't care what anybody says. After you take a drug for a long period of time, and it's not really known to what it does as far as the mechanisms and everything like that to this drug. I mean, and what it does to your body, and your body has dependence on it. It really causes some issues after a cold turkey just stopping. But this is a great drug for people who have pain in their legs. It's great. It's great, and it's usually for neuropathic pain, seizures, anxiety disorder. But the weight gain, I've never experienced weight gain with this, so I mean, you could ask your doctor if you'd like to go ahead and give this a try out. I'd definitely give a talk with your doctor and see what they say, and see if they consider if this is the best medication for your symptoms or your condition, whatever it may be. But it changes in libido, increases or decreases, irritability, ataxia, attention changes, feeling high. These are adverse effects. Abnormal coordination, memory impairment. There's some fatigue, erectile dysfunction, abnormal walking, feeling the effects of drunkenness, excessive salivation, hypoglycemia, sweating, flushing, rash, muscle cramp, myalgia, kidney calcius, urinary incontinence. Yeah, with 1% of people with pregabalin, first-degree heart block, hypotension, hypertension, pancreatitis, dysphagia, oliguria, rhabdomyolysis, suicidal thoughts or behavior. That's just kind of following abrupt or rapid discontinuation, like I said, of pregabalin. Some people reported symptoms suggestive of physical dependence. The FDA determined that the substance dependence profile pregabalin, as measured by the personal physical withdrawal checklist, was quantitatively less than benzodiazepines, even though people who discontinued short-term and long-term use of pregabalin have experienced withdrawal symptoms including insomnia, headache, nausea, anxiety, diarrhea, flu-like symptoms, nervousness, major depression, pain, convulsion, hyperthyroidism, and dizziness. So, yeah. I told you guys there's withdrawal symptoms that clearly come with this particular medication. But I hope I gave a good overview of this. I could give the usual dosage of this, usually what it's prescribed in. Okay, so this particular medication comes in, I believe 25 milligrams, 50 milligram caps. They have a 150 milligram cap. They have a 200 milligram capsule. I believe they may have a 250. I'm not sure, but I know for sure they have a 300, and then it goes up to there to, I think, 5 or 600, and it is a pressed pill form. And that's a little bit more effective as far as like strength. So those are usually the typical dosage that it comes in, and the recommendation of dosage to start off with, which is a common or low dose, is between 50 to 75 milligrams. Whenever it starts getting to a strong or medium stronger dose, it gets into the 150 to 200 milligrams, and this is with no tolerance. And yeah, that's the typical dosage on this. To start out with is 50. I wouldn't go no higher than that, just to see how it affects your body. Even I would recommend to you guys is to allergy dose this if you're not getting it prescribed and you're getting it somewhere that might be unsafe and you might not trust. So definitely give a thumbs up, comment, subscribe, like this video. I appreciate everybody who watches. I enjoy doing this, and I enjoy that people like watching some of these videos. And to the haters, keep on hating.